Hey future doctors, today we are going to see about reversible cell injury. So reversible cell injury, it occurs due to the less oxygen, that is hypoxia. Also dysfunction of the mitochondria, which will cause a decrease in the ATP production. Now there are some characteristics. So first is depletion of ATP. It will include three things, that is the failure of sodium potassium ATPase pump, then anaerobic glycolysis and decrease in the protein synthesis. First is failure of sodium potassium ATPase pump. So as we know in a normal cell, 3 sodium goes out and 2 potassium goes in. So you can remember this by Nokia, that is sodium out and potassium in. But in this case, 3 sodium influx and 2 potassium efflux. As well as there will be influx of H2O, which will lead to cellular swelling and ER change. Now there are some characteristics which occur due to the failure of sodium potassium ATPase pump. So basically there will be water influx as well as hydrophobic changes will there. Then cellular swelling, ER swelling, thinning of microvilli, like this will be microvilli, it will become like this. Then formation of cytoplasmic blebs, this is known as blebs. Formation of myelin figures. So these are some characteristics which occur due to the failure of sodium potassium ATPase pump. Now we are going to see about anaerobic glycolysis. So as we know that there is a hypoxia, it means oxygen level is decreased. Due to the oxygen decrease, there will be anaerobic glycolysis which will lead to lactic acid formation, and this will decrease the pH, it means it will become acidic, and then clumping of nuclear chromatin takes place. So this was all about anaerobic glycolysis. Now we are going to see about decrease in the protein synthesis. So ribosome detached from ER and protein synthesis, it will get decreased, as well as protein decrease, then fat will increase and fatty changes will be takes place. Now you can remember this by a small flowchart. That is, if there is ischemia, so in mitochondria there will be decrease in oxidative phosphorylation, so decrease in ATP, and it occurs due to three changes, that are failure in the sodium potassium ATPase pump, then anaerobic glycolysis and detachment of ribosome, that is decreased protein synthesis. So in this case there will be influx of calcium, water and sodium, and efflux of potassium, which will lead to ER swelling, cellular swelling, loss of microvilli and blebs. In this condition there will be decrease in glycogen, which will lead to increase in lactic acid, which will decrease pH, and the cytoplasm will become acidic, which will lead to clumping of nuclear chromatin. Then third is detachment of ribosome, which will lead to decreased protein synthesis. So this was all about how ATP will decrease. Now we are going to see about second reason, that is intracellular lactic acidosis, which will lead to nuclear clumping. So due to hypoxia, there will be anaerobic respiration, which will lead to mitochondrial fail. It is followed by a switch to anaerobic glycolytic pathway for requirement of ATP, and it will result in rapid depletion of glycogen as well as accumulation of lactic acid, which will lower the pH, and cytoplasm will become acidic. Now early fall in the intracellular pH, it will result in clumping of nuclear chromatin. So this was all about intracellular lactic acidosis. Now we are going to see about damage to the plasma membrane pumps. So basically there are two pumps. First is sodium potassium pump and second is calcium pump. So in the sodium potassium pump, the low ATP, the activity of sodium potassium pump decreased and it interferes with the membrane regulated process. The intracellular accumulation of sodium and diffusion of potassium out of the cell. Then accumulation of sodium in the cell, which will lead to hydrophobic swelling. And in the case of failure of calcium pump, this will occur. So calcium ion disturbance in the calcium exchange across the cell membrane, and excess of calcium moves into the cell, which will lead to swelling. So it's all about two types of pump, that is of sodium, potassium and calcium. Now we are going to see about reduced protein synthesis. So dispersed ribosome, it will cause decreased protein synthesis. Now if the hypoxia continued, the membrane of ER and Golgi apparatus, it will swell up, and the ribosome, it will get detached from RER, thus it will disperse in the cytoplasm and inactivate the function. And similarly, protein synthesis will decrease in the Golgi apparatus. So this was all about reversible cell injury.